Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Introduce. My name is Esa Putrinda Emilia. I'm the moderator of who will manage the course of this presentation so that it can run well. I will read the names of the member of Group 5, and the first is Yulia Dwi Nur Fadilah. The second is Elvira Dwi Wulandari. The third is Berliana Safair Tania. The fourth is Karima Diastia Rumjana. And the last is me, Esa Putrinda Emilia. Okay, we from Group 5 will discuss material about antenatal care for pregnant women. And immediately, we enter the first material that will be conveyed by my friend. Times and place are yours.
Okay, pregnancy antenatal. EMC or antenatal care is care for the mother and fetus during pregnancy. How important are EMC visits? Very, very important. Through the EMC, various information and education related to pregnancy and preparation for delivery can be given to mothers as early as possible. Lack of knowledge about the danger signs of pregnancy often occurs due to lack of EMC visits. This lack of EMC visits can cause danger to both the mother and fetus, such as bleeding during pregnancy due to the absence of danger signs. EMC recommendation according to World Health Organization: A. Nutritional intervention. Dietary intervention. It is recommended to eat nutritious food and keep doing regular physical activity or exercise during pregnancy. This is done to prevent excess weight gain during pregnancy. In addition, it is also recommended to conduct education related to efforts to increase energy and protein intake every day for pregnant women in order to reduce the incidence of babies born with low weight or LBW. 1. Administration of iron and folic acid supplement. It is recommended to take iron supplements of 30 until 60 milligram per day and 0.4 milligram of dolic acid per day. This is to prevent anemia, peripheral sepsis, low birth weight or LBW, and preterm birth. 2. Calcium supplements. The recommended daily dose of calcium for pregnant women is 1.5 until 2 gram orally to reduce the risk of preeclampsia. And 3. Administration of vitamin A supplements. Vitamin A supplements are only given to pregnant women live in areas with high cases of vitamin A deficiency to prevent night blindness. I think enough for me.
I'm so sorry. Your mic.
Okay, thank you. In here, I will continue the presentation. Number 4, administration of zinc supplement is only give to pregnant women for research purpose only. And number 5, previously of micronutrient supplement, vitamin B6, vitamin E, vitamin C, and vitamin D is giving the supplement is not for both mother and father. And the next number 6 is consumption of caffeine in pregnant women is recommended no more than 300 mg per day. This is done to prevent risk of obesity and LBW. And the next B, assessment of condition of mother and fetus. In this divided into two. Number one, mother rating, and number two, fetal assessment. Mother rating divided into several. Number E, anemia. Is anemia is a complete blood count. Text is the most recommended mother from diagnosis anemia during pregnancy. And B, asymptomatic bacteria. This culture in midstream urine in the recommended method for diagnosis the pregnancy bacteria. If culture is not possible, uh, from a sign can be used as alternative. And the next C, intimate partner violence, and this is situation violence be a partner can usually be detected early as possible when ENC is carried out. And the next D, gestational diabetes mellitus is feedings of hypercamelia in pregnant woman can be classified as GDM or DM is pregnancy. And the next E, use keratis and drug. It is ENC visit. It is highly recommended to us whenever or not there was the cigarettes used either before or during pregnancy in Indonesia whenever there is exposure to cigarettes in solidity environment. Thank you. Thank you for me. The presentation explain for my friend.
Okay, I will to continue. F. HIV and syphilis. HIV and syphilis for all pregnant women who are susceptible or at risk of contracting HIV or syphilis. It is necessary to do an anti-HIV and syphilis test. Next, G. Tuberculosis. In populations with a high prevalence of TB, it is necessary to screen for TB in a pregnant woman. The next is 2. Fetal assessment. There is 5 topics. A. Fetal movement. Fetal movement can be done with CTG or count to 10 kick chart if done for research purposes. B. Fundal height measurement. Fundal height measurement. It is recommended to always be measured every time ENC. Next, C. Antenatal CTG or cardiotocography. Routine CTG is not recommended for pregnant women, only done periodically and more often in the 3rd trimester of pregnancy. D. Ultrasound scan. Performed before 24 weeks of gestation to improve detection of fetal abnormalities or the presence of multiple pregnancies. In addition, to reduce the possibility of induction of labor in postpartum pregnancy, the use of ultrasound can also improve the mother's pregnancy experience. Next, and the last, E. Doppler ultrasound of fetal blood vessels. It is not recommended to be carried out routinely in an effort to improve the condition of the mother and fetus. FHR examination with Doppler is only done periodically during ENC. Next will be explained by Karima.
Okay, thank you, my friend. Permission, I to continue this presentation. Okay, point C, precondition. This many point. Point 1, antibiotic for asymptomatic bacteria. Administration of antibiotic for 7 days is highly recommended for all pregnant women with asymptomatic bacteria. This is done to prevent recent bacteria and premature birth and low birth weight. Okay, number 2, prebiotic antibiotic to prevent recurrent UTIs. Probiotically, antibiotics are only given to prevent recurrent UTIs in pregnant women for research purpose only. Okay, point 3, administration of anti-D immunoglobulin. Only given to research purpose to pregnant women with a gestational age of 28 less 34 weeks. Okay, this point number 4, antimetabolic administration. This given to pregnant women living in endemic areas in the first trimester. Okay, number 5, tetanus toxic vaccines. Recommended to be given all to pregnant women. This administration depends on the mother's previous vaccination histories. This vaccination is not even get from tetanus. Okay, next point 6, malaria prevention. Pregnant women will live in endemic area are highly recommended to get malaria prophylaxis in the second trimester. This prophylaxis is given every month or at least 3 times. Okay, number 7, HIV prevention by giving prophylactic pre-exposure. Overall pre-P is recommended for this pregnant woman at week 6 of AEV. Okay, thank you. My presentation finished. Continue this, my friend.
Okay, thank you. I will continue the material from my friend. And point D, intervention for general psychological symptoms. And number 1, nausea and vomiting. Giving Ginger vitamin B6 or acupuncture is recommended for pregnant women to reduce nausea in early pregnancy. Number 2, heartburn. Change in healthy lifestyle and diet are highly recommended to prevent heartburn in pregnant women. If needed, anti-kits can be given. Number 3, leg cramps. Administration of magnesium, calcium, or other non-pharmacological treatments can be given to prevent leg cramps in pregnant women. And number 4, low back and pelvic pain. Exercise for pregnant women is highly recommended to prevent back pain in pregnant women. It can also be with the help of psychotherapy or the use of a special corset. And number 5, constipation. It is recommended for pregnant women to consume sufficient fiber or wet to prevent constipation. Number 6, varicose veins and edema. It is recommended to use compression stocking elevate the legs while sleeping and apply warm compress to the fat to prevent edema. And point E, health system intervention to improve the function and quality of the ANC. Every pregnant woman is recommended to have a MCH handbook and always carry it with her every time she has a checkup or ENG. ENG is not only done by doctors, but also by midwives, health workers, and court to carry out routine health promotion related to health lifestyle, and nutritional recommendation for pregnant women. Implementation of ANC at the last age time for every pregnant woman is highly recommended to reduce mortality during pregnancy and during delivery. Satisfaction of pregnant women during ANC and childbirth can improve the health condition of mothers and babies, considering the emotional, psychological, and social needs of adult women and vulnerable groups, including women with disabilities, mental disorders, women with HIV, sex workers, and minorities, can be more bigger than other women in general. Okay, so many presentation from our group. If there are wrong words or action that are not pleasing to us, we apologize profusely. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.